Today, I'm going to demonstrate how to access a peripheral venous access or an IV. A few things before we get started. We're going to need an IV start kit, which has my chlorhexidine. It has some tape. It's got some Tuba-2s, a tourniquet. It has my Tegaderm in it. I've got my IV catheter. I've got some extra alcohol pads in case, and we're ready to get started. First, I'm going to open up all my supplies and get those ready. I've also checked the order with this patient to make sure that they are actually needing an IV, and they do. I've performed all my general safety practices, my hand hygiene, my 2 patient identifiers. I've checked also that this patient is going to need some medication after I get this IV started. So I've checked that. I've made sure that that order is in there, and it is. I've pulled that up in the med room, and it is ready. I've had 3 different ways of checking the medication against the patient and the orders, and verifying that with 3 different ways. So let's get started on our IV. I want to take my flush, and I want to attach it to my J-loop. I'm going to flush that out and get that ready. I'm going to lay it here in a clean area. That way it's ready to go when I need it. I'm going to apply some gloves. I'm going to apply my tourniquet about 3 to 4 inches above where I feel that my IV will be accessed. I would ask this patient which hand is dominant. So if they are right-handed, I would probably try to put it in the left. Unless there is nothing in the left that I can get, I would use the right. The best area is the forearm area. However, you start from the bottom and work your way up. You never start at the top and work your way down. I've found my site, and I'm going to clean that using my chlorhexidine. And I want to rub this and scrub it for 30 seconds. I'm going to let it air dry for 30 seconds. Okay. Next, I'm going to take my catheter, my IV, and I found my site. I'm going to clean that again because I did touch it. Clean it again for another 30 seconds. I'm going to let it air dry for 30 seconds. Now when I insert this, I'm going to hold below where I'm going to insert just to stabilize that vein. I'm going to go in at a 5 to 15 degree angle. I'm going to make access into the vein. I've got a return, so therefore I'm going to advance my catheter to all the way to the puncture site. There. I want to hold pressure just above the catheter. I'm going to pull this out. My safety mechanism has been initiated. I'm going to grab my J-loop, pop this tourniquet off. I want to stabilize the hub of this catheter. I'm going to flush, checking to make sure it's not infiltrating, and it is good. I'm going to use my Tegaderm. Placing it over the site. want to bring this up, and I'm going to tape it right here. I'm also going to label this with my date, time, my initials that I access this vein IV. That way that then someone else coming behind me knows when it was put in and who did it and what time. This patient also has an order for some Zofran, and we have that ready. Like I said earlier, we've already got that ready in the med room. I'm gonna take some alcohol prep. This J-loop is already equipped with a clay VIN, so I'm gonna clean it real good. I'm just not gonna wipe it, I'm gonna clean it real good, scrub it good. I'm gonna go ahead and flush this. Okay, it's flushing. I'm going to clean it again. I'm going to put my medication. I'm going to insert my medication. I'll clean it. Then I'm also going to flush it again. We want to flush after we give a medication. That way that medication gets into the system and it's just not sitting in that J-loop. Once I've done that, I'm going to check this side around it, make sure that it's not infiltrated, don't have any phlebitis or anything like that, no redness or no cooling or anything like that. Once I've done that, I'm going to document the size of the catheter that I've used, the site, how many times I've stuck this patient, and the date and time, and the medication that I gave. I'll document that, and the time. And like I said, I did do my 3 patient checks for my medication when we drew it up and at the bedside.